This is one example of what I just told you. This is a septum, this is a lume of the vein, this is a septum detected by venography. MRV has no way to detect this because it cannot see what is inside the vein. Catheter venography definitely can help, and Dr. Siddiqui will speak about some other parameters we are using to define these anomalies on catheter venography. We performed in this 43-year-old female patient balloon angioplasty, and her Doppler became normal, because also it's very important to know that hundreds of patients are getting this treatment, but how they are getting, you know, follow-up, what's the right screening tool? You can't do the catheter venography every 5 days. It's just impossible. So we need to find diagnostic tool that can definitely be used to determine how we screen these patients and how we follow up these patients. And so that gets me to really the most important question. If healthy people and MS patients have these anomalies inside the veins, what's the origin of these anomalies? Simple, nobody knows. But I think we need to understand whether these anomalies are congenital, are you born with them, or they are acquired through the lifetime. And so I think that number of scientists, including Professor Zamboni, are suggesting that these anomalies are truncular embryonic malformations, which means when the veins are created during your embryonic phase, something happened wrong, and that's why you have these malformations. But given the prevalence in healthy people that I just gave you from our studies, we need to consider that that could be physiological. Because if 50% of healthy people have something inside the veins, I mean, is it malformation or it's something physiological? Then, we are definitely finding that people who have longer disease duration, people who are older in their age, have more of these anomalies. I already told you that. So we need to consider that some of these anomalies may be aging related, could be inflammation related, because there is a lot of inflammation in MS patients, could be related to the changes in periphery. If you open the literature, you will find that people who have hypertension or people who have chronic pulmonary obstructive disease have also reflux in their jugular veins. And then, does it mean that something in the brain which is reducing the metabolism in the brain can also lead to these abnormalities? I don't know the answer, but clearly longitudinal studies need to be conducted to make this topic more clear. And this is really the basic of the problem we are discussing. So I will stop for a second, and Dr. Weinstock will continue.